Jackie Lewis, a pharmacist based in Exmouth in Devon, won Community Pharmacist of the Year at the C+D Awards 2020 for developing a new programme to train pharmacy staff to spot cancer symptoms in walk-in patients called Not Normal for You. C+D visited her pharmacy to find out how it all started.
So when I started to see my patients and doing things like medication reviews, I would say to them, are you on anything else? And they would say, well, I'm on gem something or other for cancer. And I'm like, wow, I didn't know you had cancer. And this drug that you're on, can it interact with any of your other drugs? And there just seemed to be a need, like people didn't have their injections delivered on time. We still don't know what drugs people are on from hospital when we're conversing with people, but it just seemed that hospital were doing a very good job, but we were still seeing cases in the community. So I started to work out what sort of cases we were seeing, and if there's a way that we could upskill ourselves and help. It's the whole pathway. So bowling along with this work, a local GP became the Macmillan cancer pharmacist, cancer GP, Macmillan GP for the area. And she said, I know you're doing some good work, like let's work together. And then we gradually got CCG involved, the LPC, NHS England, and the hospital as well, local hospital. And then it was, right, all sitting around a table, what do we want to do? And they said, well, let's start at the start of the pathway. Let's look at red flag symptoms and how pharmacists can help get people in front of their GPs. So that's where the Not Normal for You project evolved. So we applied for grants, got turned down, applied for more, and eventually got a grant from the MPA and the Health Education Foundation.
Yeah, and so how does that kind of start almost? So someone comes into the pharmacy and then a member of staff speaks to them. Where does it go from there?
So before you get to that stage, the team is trained. They're trained to recognise red flag symptoms, and that is from the first port of call of the pharmacy, which isn't the pharmacist, it's a counter assistant or the pharmacy assistant. So we trained the team in 10 pharmacies, and they suspect a cancer red flag symptom. Sometimes people come in with it, like, please can you look at this mole? Sometimes they come in to buy things like Nexium, and they're repeat purchasing it, and that's for stomach acid. And if they're repeat purchasing it, there is a problem. So it's teaching the staff to recognise that. And when they recognise that, then the idea is that you have this card and you write on the back what the symptoms are and say, I think you ought to go and see your doctor. Okay. So it's empowering the patient to go and see their GP. Obviously you don't mention the fact that you think it might be a cancer symptom, but you do need to. So the part of the training is to empower the staff as well to break down the barriers to seeing the GP. Initially they would just say, oh, but I can't see my GP for 3 weeks, and lots of barriers like that. Very early on we had a case study in a pharmacy in Newton Abbot where someone had a cough for 6 weeks. The pharmacy team sent him to the surgery, and then a month later the pharmacist was at a GP surgery meeting. So you know that guy that you referred to us, well, he's being treated for cancer now, for lung cancer. 6 months later his wife came in and said he's cured, thank you very much. So we made a real impact.
Definitely.
But what shone out was the relationship between the pharmacy assistant and the customer. So trusting, so brilliant. They're brilliant people. They know their stuff. They like their customers, and they can really look after them. So that was the biggest standout thing for me. I had breast cancer myself, so I've been on that pathway as well. But after all this, it's a slightly ironic thing. But yeah, so that came, my passion for it came before my own diagnosis. It just gave me completely new, a better perspective, not a new perspective, a better perspective on the pathway. And that has really gone into all of my project work and my e-learning, because I can tell other people about it, what it's like, and then they can understand, and when they're speaking to their customers, they get it more.
Yeah.
But everyone knows someone with cancer, and so that's a really good hook for training other people. This programme was a study, and I wasn't allowed to use it beyond the 6-month study. So I'm looking for, we've left it unpatented, unprotected, anyone can pick it up. So we're really looking for people. We've made it so simple, really looking for people to take it on, maybe NHS England or someone.
What would you like to see done with the Not Normal For You project?
I'd like someone to say, let's do it, let's roll it out.
And who would that someone be, like, in an ideal world?
The PSNC, Health Education England. I think it will happen, but it's just going to be such a long period of time, and it's such a shame.
Jackie explained that even though Not Normal For You may have been put on hold for now, A.D. Williams, a pharmacist in Bedminster, was now in the process of applying to the National Institute for Health Research to include pharmacists in the 2-week emergency cancer referral system. With the pandemic at the moment, have you been able to continue on referring and getting those people treated, or has things kind of stagnated?
I've had to use all my skills to persuade the people to go, because they say, oh, you can't see the doctor now. And I have to say, yes, you can, yes, but it's slightly different. They may not see you, but they will e-consult. You know, they won't ignore you. And if you've got any problems, you come back to me and I'll make you an appointment.
Find out more about the C+D Awards at chemist+druggist.co.uk.